What are we thinking?
So I started this Vets I Recommend. I think this is our third week of doing this. And I started it because people are always asking me, Carrie, what vet do you recommend? What vet do you recommend? And Orange County, which is where I'm from, we don't have a lot of truly holistic veterinarians. And so I struggle, and a lot of the information I have to seek out and send my clients to are outside of Orange County. And so I thought I would bring and I got to tell you, Dr. Morgan, I can't even believe the team that we put together. Like the people who agreed to the doctors who agreed, like yourself, to come on here, every couple of weeks or whenever it is that you come on here. We have the most amazing holistic veterinarians that are going to be on Vets I Recommend, that I'm so very excited. But what I would like from you before we get into, I'm sure, what will be a great amount of questions, is can you explain to us, like, how do you define a holistic veterinarian? What is your definition of that?
That's a sliding scale. So personally, I consider myself an integrated veterinarian. I have a lot of holistic modalities in my toolbox, and I will tend to gravitate toward that toolbox before I gravitate over to the traditional toolbox. But I love surgery, and that's a traditional healing method. That's not really what we would consider a holistic method. Although if we're doing things like ovary sparing spays or vasectomies instead of castrations, then maybe we could look at there's holistic surgery as well. But for acute problems, an acute crisis, traditional medicine works really well. It's our chronic problems and the chronic inflammation, the things where the body has just gotten so out of balance that it can't heal. That's where the traditional medicine really, really comes in, or the alternative medicine really comes into play, because I think that traditional medicine totally fails us in those chronic diseases. And looking at things from a holistic standpoint, our goal is to not allow the body to get that far out of balance. But unfortunately, if the parents of the puppy or kitten were not holistically raised, and that they're eating poor quality food, they have a history of allergies or other genetic problems, puppies and kittens are getting started off on the wrong foot, from the first breath. So it would be really nice if people with their puppies and kittens would start out on the more holistic path and not over-vaccinate right off the bat, and not automatically deworm 10 times when they don't need it. So if we could get people to start off right off the bat with looking at things from a different standpoint, I think that would be a lot better. So unfortunately, there are not enough holistic veterinarians to go around, and we are having a really hard time getting holistic veterinarians or traditional veterinarians to jump on our bandwagon. New graduates, very difficult to get them to jump on that bandwagon. Interestingly, because I don't have a license in North Carolina, all of my animals needed veterinary care. So today I packed up 4 dogs and a cat and went to the new veterinarian in town. And it was like kindred souls. We both went to Rutgers University for undergrad. She's from New Jersey and moved down here to North Carolina. And I took her copies of my books, and she was so excited. She said, funny thing, we were just talking, yesterday, that it would be really nice if we could do some home cooked recipes for some of our patients.
Wow.
And here I come handing her a couple of cookbooks, and so she hasn't been trained in holistic medicine, but she said, well, what are you feeding? Raw diet. Oh, okay. Like, I didn't get any pushback, and this is a traditional veterinarian. And I mean, she knew I was a veterinarian. She didn't know who I was. She had never heard of me. So that was quite interesting. It might have been a little well, she's not in the holistic.
I know.
So it was a fun. We were there for an hour and a half, and it was really fun. She did a great job with all my animals. Of course, I showed up with stool samples already in stool containers, urine samples. Even my cat, I did the cystocentesis and took her urine. I had all the blood samples from the dogs and the cat. I had everything spun, packaged up, ready to go. So it made it really easy for her. And she was just kind of like, oh, what do I do with this?
Oh my gosh.
But it was so nice. And maybe just because I'm a veterinarian, even if I hadn't brought my blood samples, the fact that I thought ahead and brought urine samples and stool samples. I got up at 5 o'clock this morning to make sure I got pee from everybody. And, coming in knowing exactly what I wanted. I came in and I said, look, I want a CBC. I want the big chem screen, not one of those little mini things that, tells me about half what I want to know. I want a complete urinalysis on everyone. And my cat needs a dental because she's got a resorptive lesion on a tooth. And I came in well prepared and said, this is what I need. This is what I want. And she was all for it. And I mean, that can even be hard to find. I have clients who walk into their veterinary office and say, I want a CBC, a chem screen, a thyroid panel, a urinalysis. And their veterinarian goes, what do you want that for?
Yep.
It's like,
I just had that with a client. I recommended she go in and get a certain blood test, and her vet basically thought she was crazy. His response, she wanted to get a vitamin D. Want to check the vitamin D levels.
Yeah.
And he says, why do you want to do that? And she says, well, because I'm going to start doing home cooked diet, and I'd like to have like a little baseline, and I want to just make sure I'm, on key. And he says to her, well, that they can die from too much vitamin D. And she says, well, yeah, that's why.
Yeah, and they also can have, increased risk of cancer and cellular problems, muscle problems, heart disease if they have low increased inflammatory bowel disease if they have low vitamin D. So yeah, we kind of need to know.
Yeah, that's why she was like, I'm confused. That's why I'm asking you to run to the test. What's the problem? Like, I get it. It was very weird when she came back to me and said he didn't want to run it for her. And she's like, why did he try to talk me out of running it? And I said, I don't know. Maybe he doesn't have a panel for that. I don't know why he would want to. He could make money off of it.
I know. It's like, look, I'm standing here with my credit card, my checkbook, my cash. I'm asking you to do this. Why are you saying no?
Yeah, it was very strange. She said it was the most surreal thing for her. She didn't understand. And so she left getting no test, nothing done.
Yeah. Bummer.
It was really weird. So, but I want to go back to the fact that you said integrative. And I love that because I love it and I also hate it. And they're not you necessarily, but because I have some integrative veterinarians in my area, but they don't know anything about holistic. So I don't know why they're using that word. They have 0 holistic modalities, but their sign says integrative. And so
and part of the problem that I see, a lot of veterinarians have learned acupuncture because it's almost mainstream at this point. And I found that in the practices around me up in New Jersey. I was the first one to learn acupuncture and start doing it. So their clients were coming to me to get acupuncture. And then while they were there, they discovered, hey, not only did we do acupuncture, we did vaccine titers, and, we didn't use as many chemicals. And so it was a totally different ball game. And then the clients would want to stay with us, which I never wanted to steal anybody else's clients, but certainly it's their choice because it's their pet, what kind of medicine they want for their animals. So almost all of the practices surrounding me sent someone to learn acupuncture so that they could offer acupuncture. The problem is if you're offering acupuncture in one hand and a prescription diet and flea and tick chemicals and 17 vaccines on the other hand, sort of like that doesn't gel. So that is a problem because there are practices who say that they're holistic. And when you walk in, and that's because they offer acupuncture or one modality, and then you walk in and it's a waiting room full of prescription diets and all the flea and tick chemicals and heartworm chemicals. So not really holistic. And yes, we could call it integrated, but it's at a different level.
Yeah.
So it is a sliding scale.
Yeah, real quick, I just want to say hello to everybody because we have a lot of people coming in, and we're just so happy you guys are all here. Remember that this is a group thing. So if you guys are even communicating with each other, that's awesome. Exploring some of the questions we're going to get into is really great. I had asked, for those of you who are coming in right now, hi, Andrea. Thomas is here. Sonia.
I recognize a lot of names.
Yeah, a lot of people are coming in, so it's amazing. Andrea is one of our the admins for Saving Pets One Pet at a Time. So she's on here. So it's just, I love the integrative word, but in particularly what was really upsetting for me, some of the integrative veterinarians that I've seen, is I asked one of them when I was thinking of referring to them how they felt about the raw diet. And I remember her exact response was, whatever people want to feed their dog is fine with me. And I thought, God, that mindset isn't even close to integrative or holistic. It's just kind of, it doesn't really matter what you eat. And so that made me start thinking, okay, maybe that's not quite where we need to be.
Well, at least she didn't say, or he didn't say, I'm against raw feeding and I'm against homemade food. So that, it was a little step in the right direction.
Yeah, no, I agree. And that is something I kind of thought about a little bit. At least we weren't going to, shame me into, whatever. But what I do like about the fact that you say that you're integrated is that sometimes when I tell people that I am going to be bringing on holistic veterinarians once a week, and we're going to be talking about these vets I recommend, some people kind of shut down and think that we're going to be, burning candles and incense and chanting over dogs to make them better. And they kind of get this idea that we're all a bunch of crazies. And I always have to tell them, you realize that every holistic veterinarian has gone to the same veterinarian schools that your vets have gone to, that they just have kind of realized that what they're doing wasn't working. And so they looked for different modalities. That's what I love about that, the fact that you merge those two together. And I think that's so important. And it's why you're one of the vets I recommend.
Thank you. It is interesting, though. There are some holistic practitioners and holistic practices that kind of are at the far end of the spectrum with the chanting and the burning candles, and people do get turned off. Yeah. And it's a shame because those practitioners have a ton to offer, but they haven't figured out how to get just a little tiny bit mainstream, just a little bit tiny bit more towards center. Like, we have to be really careful not to be so far this way or so far this way that it turns people off. Like, I would have people come to my practice and say, well, I tried this other holistic practitioner who was closer to me, and I felt like we were sprinkling fairy dust and I couldn't buy into a lot of the things they were doing. Like, we had this one guy near us, and he had this wand. I don't know what the wand was for. All I kept hearing was stories about the wand, and it just freaked people out so much that they couldn't buy, and I don't even know what he was doing, but they couldn't buy into it. And, it made them, the voodoo thing. Yeah, Thomas, I was from Southern New Jersey, Salem and Gloucester County. He said he was from New Jersey too. So.
No, it's absolutely true. It's you go too far, I think, on any direction, and it can be dangerous. There are some animals, for example, we could talk about, you and I both are big with senior animals. Sometimes there's not enough time. And what are you going to do? You're going to put this dog through a whole lot of pain and discomfort for the last part of his life. Sometimes holistically things take time. And so we have to be very conscious of that. And that's what I like about being integrative and kind of understanding the value of both sides of it. Yeah. I think everything in my life, I try to be very, very middle of the ground. So, all right, guys, let's get into some of your questions. Please start typing your questions. But before all of you stop being so shy behind your computers, I'm going to ask a question that was emailed to me by Joey Tafoya. And Joey wanted to know, he took his dog, Frankie, to a veterinarian, a conventional veterinarian, who found out that the spleen is enlarged. His comment to Joey was that his spleen is enlarged, but it wasn't anything really to worry about. And they would keep an eye on it and see. What are your thoughts on that?
So my first thought is, what kind of testing have we done to see, is there something else going on? So that brings one client to mind in particular. Her dog, she had search and rescue dogs, border collies, great dogs. She's very holistic, as much as she could be, and still fall within the guidelines of the search and rescue stuff. But they were good. She talked them into accepting titers and doing things a lot differently, which was very cool. But she had, one of her dogs came in, and I was palpating the abdomen, and it had a huge spleen. And I was like, oh, this is not good. Middle-aged, older dog, big spleen. And so I put the dog on the x-ray table and went, yeah, big spleen. And so the first thing we did is we did a bunch of testing. Okay, we're going to do a tick-borne panel because that can cause an enlarged spleen. We're going to do a CBC chem. Now, we all know that hemangiosarcoma dogs who have a tumor that's about to rupture can have perfectly normal lab work the day before they rupture. So, that is a little troubling. But we put the dog on the x-ray table. There were no lumps, bumps. It was a very smooth silhouette. It was just an enlarged spleen, no fever, CBC chem normal, tick-borne panel completely normal. Came back in a month, spleen perfectly normal sized. Okay, don't have to get too freaked out here. Funny thing, she was in all the time, but the following year, the same month, when the dog was getting its annual exam, big spleen again. This dog seasonally, weirdly, would get an enlarged spleen. So an enlarged spleen doesn't have to send you running for your, box of tissues and freaking out. I definitely recommend doing some lab work. If you live in an area with tick-borne diseases, you definitely want to look for that. We can have viruses that can cause spleen enlargement. The spleen is an immune system organ, so it's reactive. If we have, if we have a smooth silhouette on the x-ray, we don't have to be so concerned. But if we take an x-ray and it's not a smooth silhouette, you've got a lump, a bump, a rough outline, absolutely get an ultrasound on that. But again, he could come back. So if an x-ray is normal, the lab work's all normal, and he comes back, stop eating things, and comes back in a month, and the dog's spleen is back down to normal, maybe it was having an immune reaction to something at that time that it was there at the vet's. Maybe it was just freakishly stressed out at the vet. So there can be a lot of reasons for it, and they are not necessarily all bad. So, I would do a good workup, and if everything looks fine, the next step would be an ultrasound if they're really concerned. You certainly, on that ultrasound, especially if the spleen is big enough, you could get a needle aspirate biopsy that, pretty easy to do and not really traumatic. Or again, you could sit on it and come back in a month and feel it again, x-ray it again, and see what you got.
I know he's going to go back and get another look at the spleen. He's definitely not in a tick area. He's an older dog, though. He's a basset hound, and he's an older dog. So he's going to go back and have it tested again. So
yeah, absolutely could be immune system stress, but certainly we can get lymphomas that show up in the spleen. We can get mast cell that shows up in the spleen. So particularly when we have older dogs, we're, cancery type things are a little higher on our list of concerns. But again, sometimes when we poke cancers, we make them more angry. So I think I would be looking at, what's the dog's activity level? What's the dog's appetite? There's the puppy. How, what's the rest of the overall picture? And then certainly if they could get to a TCVM practitioner, they could look at, tongue and pulse diagnostics, look at the constitution of the dog, and try to figure out, is there something that we might be able to start working on to rebalance things?
Yeah, that is such a great answer for him. Thank you. Ophelia asks, but I'm not sure if I missed something, or maybe Ophelia. She says, Tank is doing so well, gaining weight, good poops, high energy on metronidazole when Coptis stopped helping. When we stopped, if issue returns, what then? Ultrasound, x-ray, blood work, normal?
All right. So the fact that they're using metronidazole and Coptis means that we've had some colitis, bloody stool type things. So if the Coptis stopped helping, then that means we still have an imbalance somewhere. I'm pretty sure I know who Tank is, and she'll have to correct me. Is Tank a Yorkie? I think this is the little wood personality guy. If I'm not mistaken, I could be totally wrong. And if that's the case, then we might need to do some rebalancing and drain some liver qi stagnation, and maybe look at a different herb like the free and easy wanderer. Or we could need a combination of herbs, or we could need a different dosage. Certainly, we don't want to keep them on metronidazole long term. I just had an email today from someone in Italy whose dog is having a neurotoxicity from metronidazole. So we definitely have to be careful when we're using the drugs. So
it is the Yorkie.
Okay.
You're so good. You're so good. I wanted to point out that Sonia says Dr. Morgan will definitely put anyone at ease and make them realize when you know better, you do better. That's something that we often say. I know that Saving Pets, for those of you who aren't, is a Facebook group that Dr. Morgan helps with. And that's something we say a lot. And Sonia is an admin for that group as well, when you know better. But she's so right about you making people feel, at ease and comfortable enough to talk. And look at her knowing exactly who this is, the little Yorkie. And believe me, I mean, she's got her brain filled with so many cases and dogs and questions and stuff. So that's awesome. So Ophelia says, thank you. Back to metronidazole. I got to tell you, I see more dogs on metronidazole. I mean, for years.
They're not like candy.
They are given this drug and they get into, I just had a client the other day ask me, she's so fed up with it. She said, every time she takes her dog off metronidazole, she's in that cycle that like the dog cannot be off metronidazole. So she's asking me what I would do. And I just told her, you either got to find a veterinarian that can help you through this, or you're just going to have to break the cycle and it's going to suck. But what would you say to that? Like, how do you?
I would say, first of all, let's do something like the animal biome testing, where we can look at the gut microbiome, and it probably is really out of whack. And maybe that dog needs the fecal transplant capsules. I would look at doing the NutriScan testing to see what foods we're feeding this dog that absolutely do not agree with this dog. And I would try to figure out the constitution of the dog, which I have Pet Personality Profile free download on the website. There's actually a Human Personality Profile free download on the website. You can figure out what personality you are, which Chinese element. So it helps you rebalance. So that's a dog. If it's having, so that could be a liver qi stagnation. It could be the liver overacting on the large intestine. It could be, there's so many things that cause that heat. It could be, if I see that a lot in dogs who are fearful or anxious, or aggressive, dogs that get really stressed out by any changes. So it could be a metal personality who they like all their ducks in a row. It could be a water personality who's very fearful. Every time there's a thunderstorm, the dog is quaking and hiding under the bed. The next day you have bloody diarrhea. Anything out of their normal routine. It could be a wood personality dog who's got liver qi stagnation. And I'm sorry for those of you who don't follow me and do the TCV. I'm speaking another language. But the liver qi stagnation, those are frustrated dogs who have all of this anxiety and energy stuck in their middle. It causes a lot of heat, and that heat can show up as regurgitation. It can show up as acid reflux. It can show up as colitis. And we have herbs to treat all those things. So the Coptis is a great one. You started on a whitefish pup loaf elimination diet. Perfect. It's a nice cooling diet. It's easy to digest. It's a really good thing. microbiome destroyed with metronidazole. Yeah, Hyovara. Yeah, absolutely. Metronidazole it wipes out everything.
Yeah, it's just it's I see puppies going in. I was speaking with Dr. Suter, and she was talking about how when she gets puppies in, because she knows that the mother probably isn't anymore. We've destroyed so many generations that the mothers probably aren't even passing down enough gut bacteria for these puppies to survive. And then they straight away go to the vet, and the vet puts them on metronidazole because they got a little nervous diarrhea. So she really likes to give good, soil-based probiotics just from the get-go. Like, just from the get-go. Which is why the integrative or good integrative veterinarian or a good holistic veterinarian is so valuable, because that's how you set them up for success. Whereas the traditional vet, right? Well, you go in and they give you your metronidazole, your dewormer, all of that stuff
and 6 vaccines. I read a really interesting article the other day talking about dogs that are born by C-section versus dogs that are born naturally. And we've seen these same studies in humans, but dogs that are born by C-section have a much higher chance of being allergic dogs, leaky gut dogs, having all kinds of issues, because when the puppy passes through the vaginal canal, they get a lot of the bacteria and normal flora, the microbiome that is present in that passageway out of the dog. And if they don't get that, they don't get that immune stimulation that helps build a good immune system. So a huge problem in certain breeds. So I got to the point where I didn't even want to see French bulldogs in my practice, because they always came in with food intolerances, allergies, just destroying themselves. They were parasite mavens because their immune system couldn't fight off the Giardia, the hookworm, the roundworm, everything else that they were exposed to. And they were kind of a nightmare and really difficult to fix. But it's because it started out literally on the day they were born.
Oh my gosh. I am so glad you brought that up, because I see a lot of bulldogs, and they're always they're a hot mess. They're a hot mess. And I hadn't even considered that a lot of them are C-sections. And I know that most of them are C-sections. It just didn't. Yeah, you're brilliant.
So it was a great article. I probably should talk about it on Facebook Live.
Oh my gosh, please.
It was just one of those, like, in passing, was like, oh, that's pretty interesting. And then it's like, that's real. But we see the same thing. And actually, I was a C-section baby, and so was my sister. So and actually, I had a ton of allergies. I was like the allergy poster child, mostly through high school and college. And I did immunotherapy for it, and I'm not allergic to anything now. But at one point, my allergist said, you need to quit your job. You need to get rid of all of your pets. And I said, well, my cat sleeps on my pillow, so I'm not going to do that. And I'm not quitting my job because I have a little too much invested in my career. So I did immunotherapy, and it thankfully it cured me from being allergic to anything. But yeah, it's a huge problem for these animals.
That's interesting. When you guys are out trying to find, sometimes people get them rescues and some people buy dogs from breeders. That would be an interesting question. It is to find out how that puppy was born. Was he C-section baby? Was he born naturally? Because that could affect his long-term care. Jennifer, I am so excited about this next question. Dr. Morgan is so excited about it. And the reason why is because we're going to be talking about Pyometra. Jennifer wants to know, she would love to know your thoughts for the best age to spay small breed dogs. That's part one. But the part I'm excited about is also, do you know any way to reduce the chances of a dog getting Pyometra? Can you maybe explain a little bit at why those two things are connected for our listeners that don't understand?
Yeah. So a Pyometra is an infection in the uterus. And so if we go all the way back to embryology, which was a really tough class, the uterus is actually on the outside of the body. I know that sounds weird. Your bladder is actually, the inside of your bladder is on the outside of your body. The inside of the uterus is on the outside of the body, and our digestive tract, our small intestine, our large intestine is on the outside of the body, because there's a hole that opens to the outside. And so when it's formed, that's actually the outside. The problem is that if we get an infection in one of those outside areas, they're difficult to treat. It's like the external ear canal, it's outside of the body. So there's barriers that keep antibiotics from getting into those areas if we have an infection. So if you get a Pyometra, you basically have a bag of pus that's sitting inside the body, but has an opening to the outside of the body, and antibiotics don't get in there to treat it. I actually had a woman who's a Doberman breeder and very holistic with her dogs. And she had a couple of dogs that got Pyometras kind of middle-aged later in life. And she said, I absolutely am not going to spay these dogs. What can we do? And we actually did acupuncture and herbs and got the dogs through their Pyos, and they went on to breed on their next heat, and have healthy litters, which kind of blew me away because I had never done that before. And it was just because this one client pushed me and said, no, we're doing it this way. And I went, okay, we'll figure it out. And so that's a great way to learn. And some veterinarians get really wigged out when they're pushed into a corner. I just looked at it as a challenge and said, hey, I'll work with you. We'll figure it out. So she researched, I researched, and it worked out. I really, for the males, and we just have, hey, leave it. No, we're about to have a shocking experience. Stop, go. I got puppy chewing on cord. So for the males, I have gone to leaving everybody intact. So I have 2 intact males in my house right now. Everybody wears piddle wraps because they like to have pee wars, and that's fine. I have washable, reusable wraps, and I'm fine with that. My girls, all of my dogs are rescues. So usually they're breeding females that are done being bred, and they're taken out of the breeding program. So they're getting spayed 4, 5, 6, 7, 8 years old. And I think that's fine. Certainly leaving them intact is an option. There was another great study, and I posted some stuff about it a while ago, but there is a great study, it may be in that Forever Dog book, where they looked at the different breeds of dogs based on their size. Based on their size as far as when the optimum time was to spay, and what the risks were for cancers based on the size of the dog. So the larger breed dogs were more prone to hemangiosarcomas, osteosarcomas, things that leaving them intact seemed to protect. We don't see those as much in the smaller breed dogs. So what they kind of came up with was that the smaller breed dogs could be spayed at an earlier time. So when I retired, what we were doing in my practice was for the smaller breeds, we would wait until about 24 months of age. So we let them totally, fully mature, go through a few heat cycles, and again, with our responsible clients. And then we would go ahead and spay them. If somebody opted that they wanted to leave them intact longer, not a problem. For the larger breed dogs, a lot of them, we were waiting until they were actually a little older, till 4 or 5. Like, we really wanted them to be able to keep those hormones intact as a protective mechanism. The other thing that we found is, and I read something about this today as well, when you spay these larger breed dogs at middle age, you're really disrupting their endocrine system. And many of them within 6 months will be hypothyroid. So what I would tell my clients is, okay, we're going to spay this dog at age 4, age 5, whatever, because you're starting to worry about Pyos and other things that could potentially happen. In 6 months, we're going to be doing thyroid panel, and we're going to do that every 6 months because there's a good chance it's going to crash, and we need to support that. So I don't think that we have all the answers to that. How do you protect them from Pyos? Good immune system. You want to have them on a really good, healthy, human-grade diet. You want to keep them well balanced, as emotional state, all the things that you can do to support that immune system is really what you need to be doing. And the highest risk of getting a Pyo is 6 to 8 weeks after they go through their heat cycle, because that's when the cervix is open, and if bacteria are going to get up there, that's when they get up there. So certainly you could monitor urine samples, once a week, just with dipsticks at home, looking for white cells, red cells, high pH, things that might indicate some urinary tract infection starting to occur. And like I said, we have herbals that can be very effective for these guys. Like I have a recipe in the Yin and Yang book called bladder damp heat. That would be a great recipe to use to avoid the damp heat that could occur right after the heat cycle.
So my female, I did end up spaying her at 8 years old. And like you're saying, I knew Pyometra was a risk after a heat cycle, but this is very interesting. She was born with a condition called ichthyosis. And for whatever reason, when she would go into heat, she would be at her best. The hormones had some effect on it. I don't know. And so I just thought, I'm never going to spay her. She's just better off leaving her the way she is. But then when she hit about 8 years old, we couldn't get her out of heat. And so she just stuck, and she was in it for quite a long time. And I finally just decided, I'm just going to go ahead and spay her. But so people ask me all the time, like, you had an 8-year-old dog that wasn't spayed. And what about Pyometra? I've had traditional veterinarians, conventional veterinarians say to me, they're going to die from cancer and all this stuff. And so that's why I was very interested, because when I tell people about spaying and neutering later on in life, of course I give them but be careful of this and why. And
yeah, I mean, it's really just being a vigilant pet owner.
Yeah.
I actually, my second year in practice, before I was holistic, we had a dog that died of a uterine rupture because she had a closed pyometra. She wasn't draining the pus. The owner didn't understand what was happening, and the dog uterus ruptured. So pus in the abdomen, and the dog died. So if you are leaving your female intact, you just need to be very vigilant in that period, 6 to 8 weeks after the heat cycle. And in a dog like yours, where they're not coming out of heat, that's cystic ovaries. And when you have cystic ovaries, you're looking at pyo. And that's a dog who's just it's a pyo looking for a place to happen. So if you're getting repeated false pregnancies, or you're getting a dog that's just bleeding excessively, not coming out of heat, those are ones where that's the time where you just have to bite the bullet and say, I think spaying and avoiding the pyo and the chance of death from septic infection, it's a good choice. But it's going to be, it's an individual thing. There is no one size fits all for anything.
Anything. And that's what I tell people. If you're not going to spay your dog, but you also don't think you're going to be diligent and paying attention and be honest with yourself. Like, I'm not going to tell you, then I think you're a bad parent if you can't be honest with what you can do for this pet, because ultimately it comes down to your lifestyle, your pet, your ability to do it. It's not about what I say or Dr. Morgan says or any of the vets on Vets I Recommend say. It's what are you going to be able to do? Right. Because if you don't follow through with it, you could cause more damage. And you could really ultimately, if you're not going to spay your dog because you think it's the right thing to do, but not pay attention to your dog, you could kill your dog. Like, right. I don't want to be part of that. Dr. Morgan doesn't want to be part of that. So, no. You guys got to be honest with yourself and that doesn't make you a bad pet parent, right? Like, just because you don't do what someone else tells you to do doesn't make you a bad pet parent.
Right. And that's why I say, if you're leaving them intact, we would recommend that if you are a responsible pet parent. My neighbors right now, they have first of all, they have the most horribly bred Doberman. It barely even looks like a Doberman, and somebody cropped its ears by just cutting them straight across the top. The weirdest looking dog. And the dog just had puppies 6 or 8 weeks, 10 weeks ago. And we're pretty sure that the stray dog that we ended up adopting is the dad. Aww. We did DNA testing on that dog. He's like Chow, Shar-Pei,
hamster,
5 different things that are not anything that I would ever breed with a Doberman. So they've got this litter of puppies up there, and literally they have puppies every 6 months. Yeah. They used to have these big Great Dane boxery looking things. Those are not dogs that I would recommend leaving intact. Clearly, they're not spaying and neutering anybody, but that is not what we want to have happening.
And that's the thing. Like, it's really hard because I work in rescue. And so I work in an environment where people are very adamant about spay. I can't even talk about it. Like, just don't even bring it up. But every once in a while, a little window might open, and they'll find out how I feel about spaying and neutering, and I'll say, well, we're talking about responsible pet owners.
Yes, absolutely.
And then they go, oh, that's a people can be responsible. I'm like, yeah, they can be.
I think I just read it the other day. It's either the Netherlands or Denmark. They're not allowed to spay or neuter.
Wow.
Unless there is a medical reason, like a PIO.
Yeah. That's interesting.
Can't do it.
Yeah. I know I spent some time in Nuremberg, Germany, and it was the International Pet Expo. And I met a lot of people from different countries, and we talked about that and how healthy their animals are and how they weren't spaying and neutering them. Most of their males are intact completely. If you go to Europe, they're all walking around with stuff hanging between their legs. It's the craziest thing, but they're also very, very healthy. I'm going to get to Coco's question. This is one of my favorite things to talk about. One, I used to have a bulldog named Millie, and so I dear to my heart are these bulldogs. What is the first step? The very first step. We know there's lots of them, but what is the first step in fixing a leaky gut? I have a male English bulldog. I just received his animal biome results. I love those results, and he's pretty severe. Main symptoms are skin issues, chronic infections. He has been fed.
I think that's raw.
Oh, raw. Sorry. Yeah. Oh, yeah. Raw fed for 6 months. He's allergic to whitefish and turkey. What would you think her first step is?
Well, first of all, he's a bulldog. So probably born by C-section, maybe to parents who were kibble fed, which there's another great study that came out of Europe on that as well. Dogs who are prone to allergies, if the parents of that dog are kibble fed, the chances of the dog having allergies, IBD, because IBD is really just an allergy, are like so high, so ridiculously high. And if the puppies are kibble fed at the beginning, it's almost like you can't fix it. If you take those puppies from the kibble fed parents and you feed them raw from the get-go, you have a better chance of fixing it. But it's almost like, the study was sort of like, don't even bother, you're just doomed. It's like, oh, thanks. I did a blog on it last fall or maybe the fall before. So I, first of all, would want to put that dog on a really restricted diet. So the bad thing is he's allergic to whitefish, because a lot of times these animals, if I put them on a whitefish diet, and I don't even care about having things balanced at the beginning. I'm looking for a novel protein, usually a cooling protein. And I just want like 2 ingredients going in that bowl so that the digestive system doesn't even have to think about it. And as much as I love raw feeding, and I have cured a lot of dogs with raw diets, sometimes for these guys with the really bad leaky gut, I will put them on what I call a crock pot diet. So he's allergic to whitefish. Other things that we could try would be pork, or we can try alligator if you're anywhere where you can get alligator, or rabbit, because those are all cooling. They're lean. I know nobody thinks of pork as being lean because we think of bacon, but pork tenderloin is actually really lean. I would throw that meat and I would pick one thing to go with it. And generally I go with butternut squash. It's a good fiber source. It's because it's orange, it's got a lot of the vitamins and minerals that we have a hard time getting in just green veggies. I would crock pot the heck out of that stuff until it is completely broken down. And then I would actually run it through a blender. And I have cured so many animals. One of my head receptionist at my office, she had a little dog that just horrible IBD. She actually went to a specialty practice to internal medicine. And of course they wanted prescription diets and whatever. I'm like, seriously, you're going to do that? And she said, no, I'm not going to do that. And we did crock pot rabbit and butternut squash. Within 30 days, that dog was almost normal. And she ended up staying on that diet for quite a few months. And then we slowly started adding things in to get the diet balanced. So that's really what I would do. Now, if you want to stick with raw, I have no problem with that. But when we have leaky gut, we're trying to make everything really simple, really easy for digestion. We don't want to stress that gut at all. Adored Beast has a really good leaky gut protocol that I probably would add into there. But it's really about taking away anything, like all synthetic vitamins, anything synthetic. We've got to get all that stuff out of this dog's system. The skin issues, the chronic infections, that's the immune system saying, I don't like what you're putting in my bowl. I'm reacting against it. I can't do it. So I'd probably do animal biome gut restore. I think that would be a really good idea. And I would find a novel protein, whatever that is. And I would at least give it a month on a novel protein and see if we can calm things down. Because leaky gut is swelling. It's swelling of the intestinal cells that line the bowel. And so when they're not swollen, the junctures are really tight. When they swell, they do this. And then we get that leaky gut problem where the proteins or synthetic things that they're eating are getting absorbed into the bloodstream and the body's just reacting. And so the body reacts by trying to spit things out through the skin, through the interdigital cysts, through the ears. It's like trying to get to the outside. And that's why we get this huge mess. So find something novel. I don't know where you're from, but if you can get alligator, we have a little dog in Cavalier in New York City. The only thing that dog can eat is alligator. Wow. God bless the owner who flies in alligator.
That's amazing. Hopefully they're not having the dog swim for its alligator.
No, it's in New York City. It's in an apartment. But it's a dog who, as a puppy, chronic giardia. So chronic treatments, chronic metronidazole, chronic fenbendazole, the immune system was stressed from the very first day. Too many vaccines, too many drugs, and leaky gut, total disaster. And she literally has cured her dog on an alligator diet. But that takes a lot of commitment to say, I'm in New York City. I'm going to fly alligator in from Florida.
Yeah. Coco, if I could real quick, now everybody who does know me, I am not a veterinarian. I'm a groomer, ex-vet tech groomer, but I'm going to add a little something to what Dr. Morgan said for the outside. If you can find a groomer that offers ozone baths, I can tell you they are amazing. I have helped so many bulldogs by doing these ozone baths to kind of help the outside of the itchy skin and the whatever's going on the outside. There's also a shampoo called, it starts with an N, and it's called Nui Gear. And I know that's a weird name to pronounce, but it's really amazing. I don't know if Dr. Morgan knows about it, but it is actually a shampoo that has good bacterias in it. So it doesn't have any cleaning agents or anything drying or anything. And it's just putting back good bacterias and enzymes back onto the skin. And it's called Nui Gear. And if you can find somebody that can do ozone, a lot of groomers are starting to use ozone baths. They're amazing. They're amazing. You have to do what Dr. Morgan's saying on the inside. That's where the root is. But for relief for your dog, I highly recommend anybody with itchy, chronic skin problems finding ozone baths to do. They're pretty amazing.
The other thing that I used a lot for my patients in New Jersey is a Thera-Clean Bath, which is microbubbles. Mm-hmm. And at the time when I was in New Jersey, there were only 2 groomers in the entire state of New Jersey who had the Thera-Clean system. Luckily, one of them was only an hour away. That's where my dogs went. And I found her because I was looking for somebody who did Thera-Clean. Yeah. Again, it doesn't use any chemicals, shampoos. Yep. It's a micro bubble system that literally, it's sort of like putting your dog in almost like a whirlpool bath. It's bubbling. Mm-hmm. And, when they're done, there is this pond scum on the top of the tub of all this stuff that bubbled out of the hair follicles, mm-hmm. and all the crusts and things that come off the skin. All of our rescue dogs that came in, we always take the worst cases. So all of our rescue dogs that came in with just horrible allergies and skin problems, we would take them for the micro bubble baths, and it was amazing, really amazing.
It's so crazy to me that, people come in all the time. I just had a dog the other day come in and with its medicated, you know what I'm talking about, the chlorhexidines and the this and the that, and they're just shocked that it's not working. And I'm trying to explain to them, your skin has its own microbiome, so we can't just keep killing everything. So I just would say, for those of you who are dealing with skin issues, be really careful about killing everything and being more conscious of the skin being an organ. It happens to be the largest one.
Yeah. Interestingly, my first Doberman that I owned, because I was a Doberman person before I was a Cavalier person, then I got too old to pick up Dobermans that can't walk, so I switched to a smaller breed. But my first Doberman was a blue Doberman. I always wanted a blue Doberman.
So
I didn't know that blue Dobermans have color mutant alopecia, and they're beautiful until they're a year old, and then they're bald. And they're stinky, and they have seborrhea, and they're a big mess. And so for years, every week, that dog got a tar bath and an Oxydex. So benzoyl peroxide shampoo and a tar shampoo. So we were killing everything. And he had this funky odor that went along with the shampoos. It did keep him from being a greasy, disgusting mess. But I would love to have that dog now and be able to do everything totally differently.
Yeah.
But those guys are a special color mutant alopecia dogs that are a special case in their own right.
Yeah.
Don't recommend that breeding either.
We're going to be coming up on an hour, which is what I try to keep everything at. But I'm going to ask a question from Thomas Clark. He we're coming up on the 4th of July, is going to be coming pretty quick. He wants to know what you would recommend for fireworks. He has a big husky, who's afraid of the fireworks. I shouldn't make fun, but I always think it's interesting that these big dogs are like, they get so scared. But what are your recommendations for it?
So my grandmother was scared to death of thunderstorms. And so, of course, her Dalmatians picked up on the fear of thunderstorms. So every thunderstorm, which is, just a different firework, my grandmother and the dog would hide in their closet. So I grew up with thinking that that's what you did during thunderstorms. Everybody goes and hides in the closet. So we actually have a ton of things on our website that we use for that. And I'm pretty sure I have a couple of really good blogs on firework and storm anxiety. If you go to the website and put in the search, fireworks or anxiety or 4th of July. So there's a homeopathic product called TFLN, which is thunderstorms, fireworks, and loud noises. And I think they actually changed the name now that it just says fireworks. So that's a homeopathic product you can layer on. I find with a lot of these animals, they are so reactive that it's not just one thing that's going to solve the problem. So we'll start with, a homeopathic product like the fireworks. We'll use a flower essence. There's one called Panic Attack, which is really good that you can layer that one on as well. I would look at music like Through a Dog's Ear, and I would start playing that, or figure out what music is calming for your dog. Whether some dogs it's classical, some of them it's actually heavy metal. Yeah, and there's actually cat music for cats, which doesn't sound anything like something any of us would like. It is screechy, loud, horrible, but that's what cats like. And I don't know who does this research. So I would look at figuring out what kind of music the dog likes. I would find an interior room with no windows, preferably a basement room where they also can't feel the vibration of the thunder. We want them to not see the light flashes. We want them to not feel the vibrations. We want to offer them a special treat that is only given at times when we want them to really relax. Like my guys love the Codskin chews. So if I had to distract them and keep them quiet for a period of time, I could, go sit in my closet and give them each a Codskin chew, and they would be like, "Oh, you're the best mom in the world, and I don't care what's going on outside." So you need to, there's so many layers that you can put on this. You can look at something like a thunder shirt. There's another one. It's not, so the thunder shirt works by it actually is a compression type wrap on the dog. Linda Tellington Jones T-Touch, she has a different wrap that can be used on the dogs. T-Touch would be something that would be amazing during those types of episodes to help calm the dog. There's also I don't know if it's called a thunder cape, but it's a different kind. It's not a wrap. It's actually something that decreases the static electricity that the dogs are feeling during those times. I would look at essential oils, calming essential oils. So that's different for every dog, which is a little bit interesting. When I used to do a lot of horse chiropractic, we would take 2 essential oils with us. We would take rosemary and lavender, and we would put it on our hands and let the horses sniff. And they're really good at saying, I like that one or I hate that one. And they're really opposite scents. So you might want to look at calming essential oils and try to figure out which one makes your dog just want to go take a nap and which one makes your dog like, yeah, I don't like that at all. So it's very simple. You just, hold your hand in front of their nose and they'll either, be like, oh, I like that, or they'll back off. Melissa Shelton from Animalio has all kinds of different essential oil blends, so that might be a good place to start. So I would layer on a lot of things. We have herbs that can be helpful. There's tryptophan, which is the amino acid that's in turkey, is very calming, so you can give that by itself. In a really bad scenario, you could resort to anti-anxiety medications, but I try to layer on everything else I can. And, I call it a safe room. So the room that I'm in right now is actually a converted closet, which is soundproofed for recording. This would be a great safe room if I had a dog that was afraid of a tornado, thunderstorm, whatever, because we're pretty soundproofed. And what I would do if I had a dog who was like that is I would bring them in this room with me when there's not anything going on. And I would play the calming music. I would give them that special treat, and I would sit with them and read to them, or just, relax and keep myself in a relaxed state and get the dog to understand this is my den. This is my safe zone. So if there's a storm coming, be proactive ahead of time. Get in that safe zone where, they can't hear, they can't see what's going on outside. And if you start de-escalating them before, like you want to preempt it. If you're going to have storms, you want to be preemptive and say, yeah, we're just going to have this relaxed day in our nice little safe room. Rather than waiting until after it starts, the dog is already at fever pitch. It's a lot harder to bring them back down if they're already up there.
Yeah, I think that's one of the problems I find, like when people are using herbs or using, even CBD, or I've heard people use melatonin, is they wait till it's already 9:00 and the fireworks are going off. And I think it's very important for you to understand that you're not going to bring down that kind of anxiety with CBD. You have to have it already down, is what Dr. Morgan is saying. Yep. So you have to preempt it. This is interesting. I looked up soundproofing dog kennels one time for this very purpose, because I thought, God, isn't there just a kennel that an animal? And guess what? Ford is making one.
Really?
Now, yes, Ford is making. You guys can look this up. Maybe Lori's behind the scenes. Maybe she can look it up for me. If I'm correct, I think the kennel was like $15,000. So I don't know, but it was completely safe. They could breathe still in it. And it was 100% soundproof, that your dog would go in and you would put them in there. And I thought, gosh, how great would that be? I mean, there are dogs who will go through a plate glass window.
Yeah, we had dogs jump through windows, but we did. So I don't know if I can show it here, but okay, there's one there. We actually, these are from Amazon. They're soundproof panels that we just stuck on the wall.
Yeah.
They're great at absorbing sound. They weren't expensive. I think I've got 6 in this room. It's basically a big closet, so it's 6x8 maybe. But, little things like that can make a huge difference, but it really is desensitizing your dog. So the other thing that you can do is you can find videos on YouTube of thunderstorms or fireworks, whatever your dog is upset with. you want to start playing them at a very low level. And remember, our dog's hearing is so much more sensitive than ours. So bring up that video and, start at 0 volume and start bringing it up until your dog's ears prick up. And when they notice that something's going on, back down 1 level. And if they walk away and they're chill, it's like, good, let it play. The next day you come back and you go up 1 notch, let it play. And after a while, they actually become desensitized.
Yep.
It's like, that's just playing in the background. It's like no big deal.
Yep.
So it really is something that you have to desensitize, work up toward. The other thing that you could have going on, we have great Chinese herbs for these. I mean, there's one called Shen Calmer. This could be a heart blood deficiency. It could, there's a lot, if you can find a TCVM practitioner, there's a lot of things that play into these anxiety reactions that these animals have. And we have great herbs to try to reset them. Because a lot of times it's an imbalance where they've got a blood deficiency, they've got a qi stagnation, they've got a qi deficiency. So many things that can play into that if we can rebalance, the acupuncture can be helpful for these. So if you could rebalance that, a lot of times you'll make it go away.
Yeah. That advice you just gave is the number one advice I give people. Start off, go get them. You can find them. They're just fireworks sounds, and you start them off in the morning and you desensitize your dog throughout the day, that by the time the fireworks are going, they're like, I've been listening to this crap all day long.
Really, I'm so done.
What else you got?
I'm so done.
Yeah, but it's probably the safest, most natural way to do. I don't know how Dr. Morgan feels about this, but I have only one dog that will get a little bit nervous. I do desensitize her and she still gets a little bit nervous, but I actually fast her the night before 4th of July, because if I don't, she's going to have diarrhea. And so I just fast her the night before. And then she's fine. Actually, I don't totally fast her. I give her a banana. So she has a banana because that's going to help anyway. And
well, that goes back to the case at the beginning with the Coptis and the metronidazole. So we had Shayna, one of our Cavaliers, we have an RV, and every time we would go for a weekend or whatever in the RV, guaranteed Shayna would be great all the way there. The next day she would wake up with diarrhea. Yeah. So we just got to the point where we preempted it. It's like, nope, we're going to start your anti-diarrheal. We use clay or Runsby Done or something like that. It's like, we're just starting that the day, 24 hours before we leave, and we'll continue it through the weekend. Never had a problem.
Yep.
So it really is about being a little preemptive. So if you have dogs who are prone to anxiety, and then secondarily you get the colitis, when you know the anxiety is going to occur, start things like the Runsby Done, the RX Clay, whatever it is that the Coptis, whatever it is that you're using for their bloody diarrhea when they get it, start it the day before. Yeah. And a lot of times you'll preempt that and not a problem.
Yeah, I have to. The same dog who has, just now that I do the sound thing, she's pretty good. But I did notice, I don't know if you noticed this, but older dogs tend to have their hearing start just like me. I used to be able to go to a concert and I'd be fine. Now I'm like, oh my God, it's so loud in here. Turn the music down. The same thing happens with our dogs as they get older. You can have a dog that's been totally fine for fireworks, and then right around 10, the slightest little noise is upsetting them. So you have to be, conscious of that and be careful. Like if one year you took your dog to the fireworks show and he was fine, that doesn't mean he's going to be fine the next time. So be really, really careful with that. Janelle says she uses the method with firework videos. I feed treats to let him know that the fireworks are positive and not negative, and she has 0 problems. That's amazing. But again, you also want to be really, I could never give my dog treats because we would have diarrhea. I do give her a treat. I give her a banana as a treat because it helps with her stomach. It's so amazing for her stomach to do that. So
see, my dogs are all going deaf as they're getting old, so they don't notice anything anymore. I have one who used to be absolutely terrified of fireworks. And our neighbor across the street from us, when we lived in New Jersey, would set off fireworks for pretty much every holiday. And we woke up one morning and we couldn't find our English toy spaniel, George. So, of course, we're running around the house for an hour, waking up my parents, going, has anybody seen George? Is George in your room? We can't find George. And then we're like, maybe somehow he got out of the house. Maybe somehow we left him out last night. It's like everything goes through your mind. Could not find the dog for 2 hours. Finally found him behind our washing machine.
Oh.
The fireworks had gone off across the street, and little tiny space like this, he was so petrified, he managed to wiggle himself back in there, and then he couldn't get out. And it was luck of the draw. As we're searching for the dog, I was like, I'm just going to throw this laundry in the washer while I'm walking by. Like weird things that you do when you're really stressed out. And I happened to look over the top of the washer and went, oh my gosh, there's a tail. And so these dogs will get in very bad places. They will do very strange things.
It's desperation.
Totally desperate. And then, of course, I felt bad. The poor guy, he was scared to death all night, and then, stuck behind the washer for the morning while we were trying to find him. Yeah. So, luckily now he's deaf. It's great.
It's so horrible that I'm like to the point now, I know I'm old, but can we just outlaw them everywhere? I feel so sorry I think about like the animals at the pounds, like who's putting a thunder shirt on them? Who's desensitizing them? Who's giving them melatonin or CBD? Nobody. They just sit in these, it just breaks my heart. So,
well, now we live in the South. It's not fireworks so much as it's guns. Every holiday, everybody is shooting off guns, like crazy shooting off. Actually, every Sunday, people around us are shooting off guns. It's just everybody does target practice on the weekends. I don't know. There's just guns all the time. I'm a non-gun family, so I don't understand it. But there's a lot of guns going off in the South.
It's sad. You guys have such great questions from everybody. I know we're at about an hour and 10 minutes, and that's about all the time we're going to take up from you, Dr. Morgan. But before we go, I just want to say, like, amazing questions, you guys. It's so important that we come together as a group because we never know where these are going to go. And so I try to, as we're answering these questions, to try to be inclusive of everybody and what your dogs or your soon to be puppies might come across and all of these things. So I hope this has been so helpful to you guys. I know it has been to me. Always talking to Dr. Morgan is just so, I love how well you kind of encompass the whole question. It's not just short little answers that don't really kind of get to the root of it, but you always get to the root of what we need to do and all the different, this is what is so great about an integrative veterinarian is there's not one answer, right? What do I do about Pyometra? Spam. Right? It's so amazing to listen to you speak and be so free with your time and be willing to speak with everybody here. And I'm just glad you're part of this group. I can't wait till the next Wednesday you sign up and come on. And we're going to be here every Wednesday at 4:00 with some of these amazing, amazing veterinarians. Dr. Morgan, any last things you want to say to anybody or?
Thomas asked if I write malpractice letters, and I used to be part of Joey's legacy. Thomas, I don't know if you're part of that.
He is.
I had to bow out because there's a few crazy people in the group, like really crazy, who are not willing to listen to reason. And it just really rubbed me the wrong way. I do agree that there is a lot of malpractice. One of my practices was 9/10 of a mile away from probably the worst veterinarian in the state of New Jersey. And, I could go on the New Jersey VMA website and I could see all the complaints against him, and I could see all the complaints dropped by the board. And it was a hand slap and nothing ever happened, and it was bad. And I actually made complaints against him too. So I understand the frustration with it. You are welcome to email me through the website, and I will be more than happy to look at your case. I looked at about 6 cases in Joey's legacy. There was only one of all the ones that were sent to me that I felt had a legitimate case, because a lot of them are not legitimate cases. They're just very vocal cases. And the one that I felt was a truly legitimate case, and it totally was, the man was not able to pursue it because the lawyers wanted so much money for him to be able to pursue it. And that is sad. So, and I did write a letter for that person, and I did it at no charge because I felt so strongly about it. So it really is one of those things. If they're like, I'm all for holding our profession accountable. I speak about it all the time when I get on my soapbox and do my rants that everybody loves on Facebook. I am all for holding us accountable, but I think we also have to hold the pet owner accountable as well. And so if you're not holding up your end of the pet care, I'm going to be really honest and say, yeah, your veterinarian's hands were tied because you weren't willing to allow them to do the diagnostics that were needed, or you went there too late, or so I'm really honest about it. And that didn't seem to be a good fit in that group. But you're more than welcome. I don't know anything about what's going on with your pet, but I'll be more than happy to talk to you.
So I'll fill in the blanks a little bit here, Thomas. I hope this is going to help you. So I was also a part of Joey's Legacy. I am no longer a part of it. I think it's a fabulous organization. But I agree with Dr. Morgan that there has to be responsibility on both parts. I know a lot about Thomas's case. I think it would be an interesting case for you to look at and see what you think about it, and if it can go any further. I know, it's hard. It's hard when pet parents are so emotional and they feel like it is veterinary malpractice because it's wrong and it shouldn't have happened. But the hard part is that it shouldn't have happened doesn't equal veterinary malpractice.
Right.
Whether you're a doctor, whether you're the best doctor in the world, there's still sometimes choices that veterinarians have to make, and they may make the wrong choice, but it doesn't make it veterinary malpractice. Right. And that's where pet parents, it's really hard for them to accept. And so in an organization like Joey's Legacy, some of the veterinarians get beat up because they're saying it's not veterinary malpractice. And then the veterinarians get attacked. Well, you don't care about dogs. And it becomes something where I think a lot of vets, including myself, start feeling like, God, I want to help, but it's really hard to get beaten up when you're just doing what you think is right.
Yep.
And that's where it gets hard for the veterinarians that are going to stick up and say, my industry needs some work. We need some challenges, but it's hard to get beaten up. I mean, I just got really beaten up on social media just recently that I'm still having difficulty with. And so you back away and you say, God, is this really worth that my family is suffering because I'm miserable now because somebody hates me? That's always so hard. But I know exactly what you're talking about. I know. So Thomas, my point is if Dr. Morgan looks at your case, I know you will be, but she's a very, very smart doctor. And, you just have to kind of accept when veterinarians, they don't gain anything by telling you it's not veterinary malpractice.
No,
there's nothing to be gained.
Yeah. I mean, like one person, she actually had a case, but she was going after the wrong thing. She was, and I said to her, this is not what caused your dog's problem, but this thing over here that I saw in the records, this caused your dog to die.
Yeah.
And you need to stop harping on this over here because this is where the case is. Yeah. She wouldn't let it go. And I'm like, if you fight over here, you're never going to win. If you are willing to turn and fight over here where the problem really is, you got this.
Yeah.
And she wouldn't. And I just said, and I even talked to Joey personally, and I said, Joey, she's very vocal in the group and she's very wrong. And she's not willing to listen to good advice. I can win this case for her if she will go after the right thing, and she's not willing to. Yeah. And that's a problem. So
I think
it wasn't worth, I was doing it as a volunteer. It's not worth, it's not worth the aggravation to me having to argue with someone to say, I can win your case, but not the way you want to do it.
Yeah, no, it is, because you have to look at the bigger picture, right? Like, okay, I know that this is what you're upset about, but that just has to go to its wayside, and you can get this. Right? Yeah, I see what you're saying. I know it is. It's a hard thing. So, but Thomas, hopefully you'll go ahead and send that over to Dr. Morgan. I think she would be great. I know that I believe it's Dr. Canizero that's looking at the case currently. It's a big case. Like, it's a lot of stuff that's going on. So there's a lot to look at. But hopefully you guys can connect and
yeah, send me a synopsis. I'm like overwhelmed with stuff to do. So send me a brief synopsis. And then, if it's something that intrigues me, or I feel like, there's really something to look at, believe me, I'll be happy to jump on board. Because that's the kind of stuff I talk about all the time on my Facebook Lives.
Yeah, it is important. I want to see Joey's legacy be successful. I just, I don't know. We could go on about that forever.
Well, yeah. When I talked to him, I was like, okay, you need to dump these 3 people. You need to ban them from the website. You need to ban them from the Facebook page. If you get rid of them, you got a lot of good people that have strong cases, but you've got a few crazies that are giving you a bad reputation.
Yeah.
And that can occur with anything. But
it does. You get people who just, like I said, like Lori's in the background. She knows just recently the situation that I'm going through, just because of a story that I shared. I shared one story of a dog who got better off of changing his diet, and then they start hating on you. And it's all it takes. It's all it takes for people to go, I do this for free, and I'm just trying to help people, and I don't, need this headache. So it's difficult, but we keep going. And so I just focused my energy on this a little bit and more of the positive side of it, and hope that I think one of the best ways to prevent veterinary malpractice for an individual person is to educate yourself as much as you can through doctors like Dr. Judy Morgan, because the more educated you are about the situations, the less likely that stuff can happen. If if we were to take Scott Fine's dog, Joey, and how he died, if Scott was educated at the time, he is now, but if he was more educated at the time to say, wait a minute, I think we should be running a blood work before we give this medication, then Joey wouldn't be gone. So if you really want to prevent veterinary malpractice, I think your easiest thing you can do personally is to educate yourself.
Yep.
And that's what we do. And we become our pets' advocates. That's the only thing we can do, is become your pet's advocate.
And that's actually why we started Dr. Judy U. And we have a lot of courses on there. And the most recent course is Interpreting Lab Values. And it's so that when you get those lab results, you can look at them and know what's abnormal, what's normal, what's causing those abnormalities, and what questions to ask your veterinarian. Because what I find when I'm doing consultations, some people are waiting weeks and weeks and weeks to get the results of their lab work, which is ridiculous because the results are in the next day.
Right.
But they're also only being told, well, his liver enzymes are still high. Okay, great. So we'll stay the course? Great. And then they get a copy of the lab work and they go, well, wait a minute. Yeah, his liver enzymes are high. What about these other 6 things that are out of whack that nobody ever talked to me about? And, if you are educated enough that you can look at those lab results and say, wait, what Dr. Morgan said, if this one's high, I should be looking at this, and I can't interpret what this one means without adding in these 3. It's empowering the pet parent. And that is my goal in life, is to empower pet owners, especially since veterinary care right now is hard to even find. There's a 30% veterinary shortage right now, and it's only going to get worse until they're predicting by 2030, the veterinary shortage is going to be ridiculous, and that at least 30% of our pets are not going to be able to get veterinary care because there's such a shortage. Which means that as the pet parent, you better arm yourself with a ton of knowledge so that you can figure out how to do things. Yeah. We're actually working on a hospice and palliative care course right now for people with older pets, things that you can do at home, how to troubleshoot things, how to give sub-Q fluids, how to even run IV fluids at home if your vet puts a catheter in, how to do oxygen therapy at home, because this is going to be getting harder and harder to find and more expensive. So our goal is to empower every pet parent to be able to do as much as they can, to have a good relationship with your veterinarian, but to also be able to call your veterinarian and say, hey, he's breathing a little harder. He's in heart failure. I know he is. I'm going to up his diuretic today, and I'm going to put him in oxygen for the next 30 minutes. I'll call you back. And your veterinarian will be like, that's great. I don't have to deal with that emergency right now.
Yeah. Yeah. No, educate. Lori, if you could, Dr. Morgan, what is the class that they need to take to learn how to read their blood work?
So go to www.drjudyu.com. There's 2 courses. There's Lab Work Simplified, which is an inexpensive course, which basically just tells you what all those abbreviations are on the lab sheets. And then there's the more advanced course where it actually tells you, okay, it's abnormal, it's too high, it's too low. These are some of the diseases that could be causing it. Combine it with these results. So we talk about CBC, chem, urinalysis, endocrine testing. And then we also added in a monthly subscription where you actually can send in lab work from your pet. And once or twice a month, I will actually do a taped recording reading people's lab work. So you'll see it up there. You can learn from other people's labs as well as get answers on what I think about your pet's lab work and what I would recommend as either further testing or treatment. So there's a bunch of different levels. You can only sign up for the monthly subscription if you have bought one of the courses on how to read the lab work. But it's all explained on Dr. Judy U. But I think it's critical that pet parents are armed with knowledge.
It's so critical. People ask me all the time, this is weird, because they'll say, what vet do you go to? And I go, well, I don't, I don't have to go a lot because I know a lot just from my history and my background. So I'm fortunate in that. But I can't tell you guys how valuable it will be for you to take these classes and understand. I save so much money because of the knowledge that I know about animals. I probably lose a lot of money on the other stuff I don't know about, but with animals, I am able to do a lot on my own. And there's so much stuff you can do on your own and you can learn on your own, and you don't have to have a medical degree to learn this. And you see how easy Dr. Morgan is to talk to you guys. Like I'm sure her classes are going to be just as easy to follow and understand. And I cannot stress enough. I can't tell you how many of my clients right now have called me and asked me what emergency room they can get their dog in for something that shouldn't have been an emergency. Exactly. It could have been done at their veterinarian hospital, but their veterinarian is booked out 3 weeks. And now they find themselves waiting in line at the emergency room, paying triple the price and waiting in line for 4 to 5 hours. That's
if they can even get in. I mean, I literally have had clients from New Jersey from my old practices texting me at 1 o'clock in the morning going, okay, my dog has bloody vomit and diarrhea and I've called 8 emergency services and nobody can take me.
Yep.
Like if an emergency service doesn't think bloody vomiting and diarrhea is enough emergency to put you to the head of the line, that's a long line. That is horrible.
Yeah.
And, being armed with being able to do things on your own, it's going to be more and more important.
It's so invaluable. And I'm so amazed that you guys I'm so happy that doctors like you and Dr. Udette Setter is putting out, like helping you guys learn. I'm telling you, you're going to regret it if you don't. So please take. Sonia says, I can attest that the classes are easy to follow and are worth the time for sure. So thank you, Sonia, for putting that up there. I personally
took the home cooking class, was amazing. That's
I didn't see that one.
How to make your own dog food.
Yes. Oh my gosh. Another one. Make your own dog food. I sell dog food, but I'm a big supporter in making your own dog food. I have your books. I constantly telling people that's when you're going to have control over what goes in your mouth, with your dog's mouth. I mean, make a little for you, make a little for them. I always tell people there's really food is food. I don't know why we have to call this dog food and this cat food and this human food.
Right. People food. Like don't feed your dog people food. Really? It's
why?
Food.
I know I mean, I kind of get the concept, like you're not supposed to feed them from the table maybe, but food is food. There's no difference. Although I would never eat dog food, like out of can. Did you see that video of of Rodney Habib
eating the dry food? Yeah.
The kibble. Oh.
I can't. Although when I was a child, I used to eat milk bones, and now I look at that and go, "Oh my god!" Like
lucky you're alive.
Yeah.
Lucky you're alive. Yeah, I could never. I mean, God bless him for doing it, but I couldn't. I don't think I could eat
No.
one piece of kibble. It's gross.
No,
So
and he did another one where he fed kibble to his raw fed dog. He tested the blood sugars on his dog on the raw food, and then he fed it kibble, and then did the blood sugars, and of course there was a 50-point difference. And I'm like, that's great. I could do that too, and do a good video series on that. I can't do that to my dogs.
yeah,
Like, God bless him for being willing to put his dog through that, and God bless his dog for being willing to do that. I don't even know if my dogs would eat dry kibble if I put it in the bowl. Like, if I hand them a milk bone, they won't eat it. So they don't recognize dry kibble as food. So that's a good thing.
it is a good thing.
But yeah, I don't like. We would get donations of dog food and stuff for like shelter dogs and rescue dogs, and I've had these bags of horrible food. I'm like, I can't even donate that to the shelter. Like, I just can't make myself do it.
I hear you. Real quick, I know I kept you, but this you're gonna love the story about. Well, it's not a good story about milk bones, but I have told people for many, many, many years that animals become addicted to sugar the same way that humans become addicted to sugar. The body starts to think of this as what it needs, just like heroin would be. Like a heroin addict can get addicted to heroin. You can put, an orange in front of them or heroin. They're going to go to the heroin because the body thinks that's what's going to make them feel better. I had a client, this is unbelievable, it was a golden doodle, and he had horrible skin and horrible ears and horrible sebaceous cysts all up and down his spine, all the way down his tail. I mean, just a mess. And I tried to get her to change the diet, and I asked her to bring in what he was eating. I go, just show me. Don't worry, I'm not going to judge you. I used to feed my dog pedigree. Like, there's no judgment here. I just want to know. So she brought in bags and bags of milk bones. And I said, that's all he's eating? And she says, that is all he will eat. She couldn't get him. So we started off because we tried regular food and he wouldn't eat it. So I said, okay, let's try a better kibble. Let's just at least start the process off of this. So then we went to Origin, and he wouldn't touch it, but he would eat the milk bones. She gave up. And to be honest, it's a sad story because it didn't end the way I would have liked it to have ended. She just gave up and said, that's all he'll eat. And I think to this day, he's still eating milk bones. But the addiction that dog had, I mean, she tried. I gave her the food. I would say, try this, try this, try this, try this, try this. Nothing. Ultimately, I wanted to take him into my home and use pack mentality to get him to eat. Like, oh, those two dogs are eating it, so maybe I'll eat it. That was my goal, but she didn't want to do that. But that dog was so addicted to milk bones. I mean, what the hell is that?
And it's interesting, if you look at a lot of those treats like the milk bones, they actually have the vitamin mineral mix added to them. Ugh. So I have had people who have fed their dogs really horrible homemade diets, like, hamburger and broccoli, or hamburger and peas, and they think that's a balanced homemade diet. And I'm like, why is this dog still alive? Oh, he eats a bunch of milk bones that have a bunch of vitamins and minerals added to it. It's like, oh, well, that's where he's getting all those vitamins and minerals. But certainly not a good thing. I actually took a client's dog in, because we're all that crazy. I had a blind client who had a seeing eye Labrador. When he got the dog for seeing eye, it was 65 pounds. The dog had ballooned to 130 pounds, so twice its body weight. And it couldn't be used as a seeing eye dog anymore because it couldn't fit in the harness. And seeing eye wanted to take the dog away because they considered it cruelty that the dog was that obese, which I kind of did too. But their answer was they wanted the dog on a Purina prescription weight loss diet, and they also wanted to put it on a weight loss drug. So because seeing eye was calling the shots, we did that. The dog didn't lose any weight. It had diarrhea. It felt terrible. The owner wasn't happy. And so I finally got mad and stood in the exam room with him and said, if I had this dog at my house, the dog would lose the weight. It would not be a problem. And he looked at me and said, would you do that, Doc? Could you take him? Could you make him lose the weight? And I went, And so I had driven my tiny little sports car to work, and I couldn't even fit the dog in the car. So I called my husband and I said, hey, honey, can we keep this 130-pound Labrador and make it lose weight? And by the way, can you come pick him up?
Uh,
And so we actually ended up keeping the dog for the whole summer. We had him for like 3 months. And he went from 135 pounds down to about 98 by the time we had to give him back to the owner because we had a hurricane and we didn't have power for 5 days. And I'm like, I can't deal with this dog and everything else. And then I made a deal with the owner and I said, I will provide the food for your dog, kind of like you did. I said, I will provide the food for the dog. He couldn't afford it. We had moved the dog to a raw diet. The dog absolutely could not process any carbohydrates. And I said, I'll provide the food and 1 bag of treats for a week. And every week you come in. If the dog loses weight every week, I give you another week's worth of food and treats. If the dog gains weight, you pay. It was great.
That is
back in the park. And he lived in an apartment complex. And so he went around. Now, this is a blind man. He went around to all the apartments and knocked on all the doors and said, hey, my dog needs to get exercise. I can't exercise the dog. Anybody willing to exercise my dog? And by the way, you can't feed him. And like everybody lined up to walk this dog. And we had gotten the dog from, he couldn't walk down the driveway, to 30 miles a week. And so he had literally people lined up to take his dog for a walk for him. And he fed the food in the amounts that I prescribed, the raw food, and the dog did amazing. And he was so thankful. And I was like, you know what, this is a small investment on my part to get a happy ending.
Yeah.
Unfortunately, he moved to Pennsylvania and I lost track of the dog and I have no idea what happened in the long run, but it did work. And, you know, frankly, it's a testament to people like us who we care about these animals so much that we're willing to do stupid things like take the 130-pound Labrador who can't walk into our house.
Yep. Yeah, no, I know. Thomas, you need to find this blind guy and his dog. Thomas lives in Pennsylvania, so maybe he can.
I don't even remember his name anymore.
And
it was a long time ago because he was in my first book, so the dog is probably long gone. The dog's name was Scanlon. Just a sweet dog, so sweet.
I just love stories like that, and people wonder why we're so passionate about diet. And when you see the results, when you see it's not just one dog. If we took all of us who are vocally out here speaking on this, we're talking about thousands and thousands and thousands of cases. Dr. Dim has probably taken to dogs. I've taken to dogs. Dr. Judy Morgan, all of us, we've all been there where we say, I know you don't need to be on this weight management food and these drugs to lose weight. This is what you need to do to have your dog lose weight. It's that's why we're passionate about it. And your story being that it was a seeing eye dog is just truly amazing, because now he has his dog back, now he has. And
I did not want to put the dog on a raw diet because I knew he couldn't afford it. I knew it was going to be difficult for him, but I literally took the dog on the dry kibble. I put him on a very high quality kibble. I know. But literally I'm feeding a 130-pound dog a cup of food twice a day. And I thought, he's not getting the nutrition he needs. His metabolism is shutting down instead of gearing up. I need to be able to feed this dog in a different manner. Of course, seeing eye would have flipped had they known what I was doing. Yep. So we just didn't tell them. But the dog ended up doing really well, and the owner clearly learned what needed to be done for the dog. So my hope was that once he moved, that he could figure out how to afford that food or find somebody else to help him out. And that the dog could do his job, because, for somebody who has a service dog, that's their lifeline. Like for him, that was his lifeline to be able to leave the house, and he couldn't leave the house if he didn't have that lifeline. Yeah. So for me, it was just really important.
Yeah, it's so important, because you can't, the training and the bond between that is not that it's easy for any of us to just go get another dog, but there's a different element to it because not only does the dog have to trust the human, but the human has to trust that dog, especially being blind. So that's just an amazing story to end on. But Debbie would like to know if you're interested in a dog.
No, I know Dash. My husband loves Dash. They have a connection. Although Dash and Forrest would probably do very well together. So his name is Dash Ho, by the way. So yeah, Dash and Forrest can keep each other company. It'll be awesome.
All right, guys, we're going to go ahead and let Dr. Morgan get some sleep. It's late where you are. It's only 5.
I haven't had dinner.
Oh my gosh, go have dinner. Go have dinner, please. And for the rest of you guys, thank you so much for being here. It's just amazing for us all to come together and be with like-minded people. It energizes us, when we have people coming on and asking questions. And I think we're reminded that our knowledge being spread out across the world is actually helping people. It's very energizing to us. I hope it is very educational to you. I know, having Dr. Morgan, who often says that she is a teacher and a salesperson, right? She is a
My
teacher.
parents, yes.
Yeah, because of her parents, and she's kind of meshed together. So I think it's just fabulous. So thank you all so much for being here. Dr. Morgan, you're I just love speaking with you. You're just an amazing person, and you do so much for not just the animal world, but what you provide for the people is amazing. I hope you'll all consider taking her classes. I know you'll just be amazed. Lori is behind the scenes. She's the one typing in all the stuff that you guys are getting from her. So Lori, thank you. I know you're in the background, but thank you so much. And I will see you guys next Wednesday. Everybody, take care.